Orbital cellulitis. It is the acute infection of the soft tissues behind the orbital septum. The infection spreads from exogenous or endogenous or through extension. Exogenous in the sense following evisceration, enucleation or dacrocystotomy. Endogenous through the blood, extensions from the face, paranasal sinuses or lids. Coming to the clinical features, the symptoms are general and of ocular type. General symptoms are like fever, nausea, vomiting. Ocular symptoms are severe pain and swelling and blurring of the vision or diplopia. And the signs are lids are swollen, conjunctiva is chemosed, and there is marked proptosis. As a result of this proptosis, the ocular movements are also restricted. On doing fundus examination, the retinal veins are congested and there are signs of papilloedema. This is similar features are also seen in cavernous venous sinus thrombosis. And the complications are general septicemia, ocular complications, orbital complications, temporal abscess, intracranial extensions. Coming to the ocular complications, if the infection spreads to nerve, optic neuritis, artery, central retinal artery occlusion and blinding. Coming to orbital complications, it may be subperiosteal abscess or orbital abscess. If the infection or the abscess is in between periosteum and the orbit itself, it is subperiosteal abscess. Here, the proptosis is elliptical type, whereas in orbital abscess, the proptosis is axial type, and all the features above are marked in orbital abscess. And there are also pus points on the conjunctiva, below the conjunctiva. Treatment is by antibiotics, NSAIDs, nasal decongestant drops. These are of medical type. Antibiotics can be given as IV and topical ointment. IV, if the infection is caused by staph, penicillin resistant antibiotics can be given, like ampicillin. If it is caused by H. influenza, Haemophilus influenza, clavulanic acid can be preferred. If anaerobes, metronidazole is preferred. Surgical canthotomy, if the orbit is tight or there is increase in intraocular pressure and if there is associated optic neuropathy, canthotomy can be done. And if abscess is seen easily, then free incision can be given to drain the abscess. In case of subperiosteal abscess, curved incision is given in the upper medial aspect 2 to 3 centimeters. Thank you.